One of the best ways I find to analyze the face is to do it in 3D. The reason for that is, as people, we find it hard to stare at a face long enough to really find all its best attributes and its flaws. So when I look at a face in 3D, usually to take away the distractions of any solar aging, such as a sunspot and broken blood vessels, I'll go into this plaster of Paris mode. So to my eye, it's much easier to spot asymmetries this way in plaster of Paris when I take away the actual skin contour. So what I look at is, in the far view, I'm looking at how well the cheek has held its shape. And so as we age, what will happen is some deep fat goes away in the upper mid-face, and it causes this little fullness in the cheek to emerge, which when we look quickly at an individual, our subconscious mind will score that face or that person as weighing a touch more, because that's one of the ways that we read weight within your face. So I'll look at both sides, and I can see this curvature here is pretty nicely preserved. So really that's doing great. Then in the far side view, what I do is I look for the flowing line. So there's a line that flows from the lower eyelid out into the cheek here, curves around, and then tracks down. So her dimple breaks that line on this side, but not on the other side. So she has a little bit of fullness here, but not really an issue. So then I tilt the face back. So here's how I can see how the support in the lower lip is working out as a feature of aging. So as we lose support in the lower lip, and that happens sometimes if we didn't have a strong enough chin, or we had an overbite, or rather an underbite, so the backside of the teeth don't push as well against the lip, and so you'll get a little bit of a sag there. So once I look at all those features, then I see really how the balance of the face is doing. I score it in my own mind for symmetry, and then I'll flip back the skin mode, and then I'll look and I'll blow things up, and I'll look at pore size and solar damage such as this, and decide really if we need to start some photofacials, which would be indicated in this individual. So she's well preserved for her age, and really my recommendation is going to be to work on a few things for symmetry. She has a wider side of the face. We see that in people who tend to clench a little bit. So a little Botox in her masseter will thin that out. And all these things that improve symmetry and proportions will result in scoring as a more attractive face.